Good afternoon, everyone, and welcome to the live webinar, the UNC Lineberger Cancer Network Advanced Practice Provider series. Today is Wednesday, August 16th. Thank you for joining us this afternoon. Just a quick reminder, if you are having any technical difficulties, please reach out. The phone number, email is on the screen. Reach out. Our team is standing by to assist you. Our webinar this afternoon will have Poll Everywhere questions, as well as you can submit questions at the end of the webinar for questions for our speaker. So join by the web, pollev.com, enter UNCLCN, and you could respond to questions that way. You can also join using your phone and app on your phone in a similar way. So to claim continuing education credit, please note that you must watch for at least 50 minutes. And this is using Zoom with video, or you could be in a room with one of the site coordinators. Just listening to the audio via your phone, unfortunately, does not qualify for continuing education credit. So at the end of the webinar, fill out the evaluation. You can claim your certificate within 7 days. A friendly reminder at the end of our webinar, if you can just please wait for our team to end the Zoom video. This ensures that your attendance is recorded and sends to our learning portal so you can claim your continuing education credit. Check out our live webinars as well as our self-paced online courses. If you've missed a live webinar in the past, there are lots of great learning opportunities through our different series. We have our patient-centered care series, our research to practice, ongoing advanced practice provider series, and then our Southeastern American Indian Cancer Health Equity Partnership. So check them out at learn.unclcn.org. There are some great speakers and topics. I'm very excited for our speaker this afternoon, Carly Bailey. She will be discussing exercise and wellness as part of the cancer experience. So Carly, our top five of Carly's bio is she is an ACSM certified exercise physiologist and board certified health coach. She is a graduate of UNC Chapel Hill's curriculum in exercise physiology, where she received her master's. At UNC, Carly was a research coordinator for the exercise oncology studies, and at Cedars-Sinai, she was a research and program coordinator for the cancer survivorship program. At UNC, Carly manages exercise and wellness programs like the Get Real and Heal program. Her goal is to ensure program access, growth, and positive outcomes. Carly is the Director of Physical Activity and Integrative Oncology at the UNC Lineberger Comprehensive Cancer Center. So thank you, Carly, for being here. Outside of your professional bio, anything you'd like to share with our audience about you outside of this?
Yeah, so I have 3 kids. They're small still. And so if there's background noise, like banging on doors or yelling my name, that's what's happening. So yeah, that, and I also enjoy running in my free time.
Have to incorporate some exercise in there, right? Practice what you preach. So this is an example of one of our Poll Everywhere, what it will look like on your screen. So our first question is: patients undergoing chemo and radiation therapy do not receive any benefits from exercise. So you can log on, hop onto pollev.com and test your Poll Everywhere, and we will circle back to that. Here are our disclosures. So let's see how they did with our sample question. How'd they do, Carly?
100% correct. Good. I'm excited to talk to y'all.
Great. Thank you all. And now I will turn it over to Carly.
Thanks so much, Tammy. I really appreciate the introduction. So I'm Carly, like Tammy said, and I'm going to be talking to y'all today about developing exercise programming for people affected by cancer. And so we're going to cover some different topics. We're going to start with why exercise is important and what makes up a good exercise program for cancer patients. We're also going to spend some time talking about how to engage and activate patients towards this behavior. And then I'm going to spend a little bit of time just reviewing what already exists here at UNC and how to get your patients involved. So by the end of this presentation, you're going to be able to define the role of different modes of exercise and how those benefit cancer survivors. You'll also have some understanding about safety during and after cancer treatment. And it's my hope that you'll have two ways to really engage your patients in exercise during and after treatment. So just last year in 2022, Jennifer Ligbell came out with a paper that said only 15% of patients report being referred to an exercise program by their oncologist. When you take that information and then look at the number of patients who are adequately active, which is anywhere between 30 and 47%, which is a little bit better than non-cancer patients. But we also know that cancer survivors are reporting no leisure time physical activity, and that for Americans in general, the most popular leisure time is watching TV, followed by gaming. So as a culture and also as groups of cancer survivors, they're all sort of moving in the direction of becoming more sedentary. And then when they're not being referred to exercise programs by their oncologists, it's kind of a double-edged sword happening for their health and well-being. So what should cancer survivors be doing? There are some recommendations specific to cancer survivors provided by the American College of Sports Medicine, or the ACSM. When you read this paper, one of the first things it says is to avoid inactivity. So that's making choices about sedentary time to be more active. Cancer survivors should also be getting 150 minutes of moderate intensity physical activity. This is physical activity where people are a little bit out of breath. They might find that they're getting a little bit sweaty. They should be able to talk but not sing when they're working out at this level. Alternatively, they could obtain 75 minutes of high intensity physical activity, but for most cancer survivors, that tends to not feel very attainable right off the bat. When it comes to strength training, the American College of Sports Medicine says that strength training should happen with all major muscle groups 2 times a week. And of course, flexibility is important to really maintain that muscle pliability to prevent injury. And then they take it one step further. So relatively recently, the American College of Sports Medicine realized that 150 minutes is a really overwhelming number for most people, but especially for cancer survivors. And so they changed it and said that general movement really counts towards that 150 minutes. And the idea is that that general movement is going to turn into longer and longer bouts leading up to those 10-minute, that's kind of the target, is that you're able to do something for 10 minutes and that adds up to the 150 minutes. They also clarified that exercise is safe for patients with lymphedema. For quite some time, we just weren't sure if cardio or strength training was something that was safe, and now we know that it is. We also know that exercise is safe for patients with advanced or metastatic disease, as long as there are some precautions that the program is taking. And then to really just decrease barriers to access, they took away the requirement for medical clearance for patients with no comorbidities. So hopefully these clarifications really helped cancer survivors kind of get up and get moving and took away some of those question marks in some special populations. So how do you know if it's safe for your patient to exercise? So there's this handy little chart that's in the exercise recommendations. And what we found is that most patients actually do fall into this category where medical pre-evaluation is recommended, or that there's a clearance that's recommended. And so to help with that, many programs use a form called the PAR-Q Plus. And this is a free form that anybody can access anywhere. And it's a 7-step questionnaire that first assesses some general health questions. And if any of the answers to these questions are yes, it goes deeper into these other comorbidities and really assesses the severity of the issue, if there's any impairment associated with the issue, and if it's well controlled, whether that's with medications or through other things. And so if the participant answers yes to any of those questions, then it says that an additional medical clearance is required before starting exercise. And so most exercise programs geared towards cancer patients use something like this to help keep patients safe before they start engaging in a regular movement program. So in addition to all of that, cancer exercise programs take into account some other really important parameters that are related specifically to cancer. So we know that even though exercise is safe for patients who have bone mets, that it's really important that you don't load those bones because you don't want to cause a fracture. You don't want to do any kind of twisting on those bones. And of course, avoiding high impact movements is really important. And that goes, all of that kind of goes for patients who have bone mets or even bone loss. Lymphedema is, like I said, we know that it's safe now, but it is really important that patients are wearing their compression garments during exercise and that the program is kind of monitoring limb volume. If a patient comes in and one of their arms looks bigger than last time we saw, we might sort of say like, hey, let's lay off on this today and you need to touch base with your lymphedema specialist before you come back and really start engaging with us again. We also know that sometimes patients who are young in age could appear more like an older person when it comes to their comorbidities. And so we do take all of that into account when we're working with these patients. And so if a patient comes in and is struggling with something that is maybe more of an older adult issue, it's sort of expected by our program and we're not surprised by it. If a patient has an ostomy, usually patients are trained on how to use it. But from an exercise professional standpoint, having supervision to make sure that the form is correct and that they're not having a Valsalva maneuver during exercise is really important and something that is sort of specialized when it comes to oncology exercise programs. And many of our patients come in with peripheral neuropathy. And so it's really important that we make sure that patients are having some kind of stability or gait assessment, because we know that peripheral neuropathy can affect their balance. And so we want to make sure that we're not going to put somebody on a treadmill who has trouble with their gait because we don't want them to fall. So folks who have peripheral neuropathy in their feet, we tend to encourage them to start on a bike and get comfortable, and then they can move to a treadmill with supervision. And then same with resistance training. We don't ever want to put dumbbells in the hands of somebody who can't feel their hands very well. So we use things like resistance bands or even just body weight to use that resistance training. And then patients who've had a stem cell transplant or who are neutropenic, we just encourage them to stay home. If patients have fevers, we tell them to call their doctors immediately. And the mantra for training any cancer patient is really kind of a low and slow progression. And that's especially true for patients who've had a stem cell transplant. Every day is new. And so kind of having an exercise program with that mentality can be really beneficial for folks. So this is your next poll everywhere. We're going to meet Amy. She is a 57-year-old breast cancer survivor. She's had a double mastectomy, chemotherapy, and radiation. She finished her treatment 3 months ago and is concerned about some weight gain. She's got some lymphedema in just one of her arms and has fatigue. She also reported diabetes on her PAR-Q. So does she need an additional clearance from her care team? Y'all are super fast. All right, it looks like those answers are slowing down. So yeah, she does need an additional clearance from her care team. Diabetes is something that we would ask that their care team signs off on that plus for cancer. We would just want to make sure that it was safe for her to participate and that we knew if there were any additional precautions So we would definitely be contacting her care team or asking her to contact her care team just to make sure that it's safe. So why is it important for cancer patients to exercise? So in addition to decreasing the risk of recurrence in some of the really major cancers like breast and prostate, there's also strong evidence that exercise can mitigate many of the common cancer-related side effects. Cancer-related fatigue is one of the really big ones that we hear a lot, along with anxiety and depression. Those are kind of the big three that come into our program that we get referrals for. And I really love this infographic because it lays out really clearly the evidence-based recommendations for exercise for each symptom. And so something that I want to point out here is that if you look at something like anxiety and depression, it's really important to note that what's important about managing those symptoms is the aerobic piece. And that if a patient is doing just resistance training and is suffering from anxiety and depression, they're not going to have that same level of benefit as someone who's really targeting anxiety and depression and doing it 30 minutes a day. And then same with bone health. So while the evidence isn't strong, it is moderate. Cardio alone is not going to help a patient who has been told that they have osteopenia or osteoporosis. You know, they really need to be using the resistance training to build their muscles and bones back up. And so the other thing that I want to point out here is that while some of this evidence is showing it shows aerobic and resistance, what we know is that this combination of aerobic and resistance is really kind of the sweet spot. And you'll see that that's where there's the most information on this infographic. And so programs that really use both aerobic and resistance and are targeting that sort of 30 minutes of aerobic and then the whole body resistance training really seem to be the way that patients are getting the most robust effects when it comes to managing their symptoms through exercise. So I'm going to dig in just a little bit deeper into some of the common side effects of cancer and how exercise can really help manage those. So I'm going to start with fatigue, which is something that I think most patients experience during and after cancer treatment. In addition to experiencing it during treatment, we know that it can be persistent for a very long time after their treatment has ended. So I looked at a meta-analysis of exercise and cancer-related fatigue, and this paper showed that exercise significantly reduced cancer-related fatigue during and after a treatment, and that during treatment, exercise had a palliative effect, and after treatment, a recuperative effect. So there was no time in the treatment continuum when exercise wasn't beneficial for managing cancer-related fatigue. The same meta-analysis looked at 70 studies, and they were pretty well divided between during and post-treatment. When you looked at the data, the primary moderator was adherence during treatment. So patients who were able to actually exercise had more robust benefits. Post-treatment, exercise program length was important. And regardless of whether they were during treatment or in treatment, the groups who were exercising had increased benefit related to those who were not exercising. Quality of life is one that's also really important. Quality of life is something that I think sometimes patients don't really think about as much, but it's something that's really important for their overall well-being. And I think that when people have better quality of life, they really do feel a lot better. And whether or not they're putting it all together is another thing. And so I found two meta-analyses, and what was interesting to me about these two was that in both of them, the supervised exercise was the really important piece. So having somebody there, showing them what to do, telling them what they needed to do that day, helping them progress through the movements, providing modifications during the workout, that was really critical. And then the other thing that was really interesting to me was that one of these meta-analyses, the Sweegers article, found that if exercise wasn't supervised, it needed to have higher energy expenditure. So these patients were probably doing more like circuit training, maybe even a little interval training, really just trying to get that energy expenditure up. And then the other important thing to note here was that there were no differences for either of these studies based on the fit factors. And fit is a framework that many exercise studies use. It's frequency, intensity, type, and time. And it really provides patients with a roadmap of how they're going to be progressing their exercise across the board. And so what this is saying is that it didn't really matter what they were doing. It was really important that they were doing something and that that improved their quality of life. And then anxiety and depression. So I've got two more reviews and meta-analyses here. And in both of them, there were positive effects for depression and anxiety. And this one, it said that supervised or partially supervised was what was important. And it was really clear. It said no home-based. And then the 30 minutes in duration seemed to really be kind of the magic number for getting those benefits of exercise. And then we know from the other data that it really needs to be cardio heavy. So that 30 minutes of cardio is what really does matter for anxiety and depression. And also that these results were kind of sustained. So this second set of studies showed that the reduction in anxiety was really maintained up to 12 weeks, which is kind of a big deal. So taking all of that into account, what makes a good exercise program? The first thing is variety. Programs need to offer cardio and strength. And I would even say that there needs to be variety within those two domains. Walking is great, but not everybody has great knees. And so programs need to be able to provide a bike or some other mode of cardio that is easy on the joints, but still gets heart rates up. And then same with strength. Dumbbells are not appropriate for everybody. So having resistance bands or even some basic strength training machines is a really great thing for exercise programs working with cancer patients so that you can better meet the needs of more people. The other piece that's really important in a good exercise program is supervision. So not just from a exercise safety standpoint, but there's also a really important accountability and personal touch component here too. So walking into a gym and seeing your trainer who knows you and knows your experience and has kind of been with you can really help motivate people to stick to the program and keep moving and going forward. So that's a really important thing to think about. And then I included using the FIT principle here. Those meta-analyses did say that the FIT principle or that the FIT domains weren't really what mattered. What mattered was that they were moving. But I think good exercise programs have to use the FIT principle because there has to be a framework to individualize the program and to provide a roadmap for progression in a way that is safe and catered directly to the individual patient. We all know, cancer survivor or not, an exercise program for one person is going to look really different than an exercise program for another person. This is not a one size fits all kind of deal. And so having some way of individualizing something can really make an exercise program that much more meaningful and that much more attainable for patients engaged in this. So your next poll everywhere, what is the best mode of exercise to improve fatigue in patients with cancer? Yeah, that combo is really, really important. And I just want to add that the combo can be really overwhelming for people who are fatigued. So yes, the combo is where the data is for sure. But if you have a patient who is just really tired and needs to do something, encouraging them to do a little bit of cardio is a great place to start to kind of open up the floodgates to a full-blown exercise program that includes cardio and strength together. Okay, so you've got all this great information about what makes good exercise programs. How in the world do you get your patient from where they are to up and moving? This is the real challenge in getting patients excited about exercise and actually making sure that they do it. Let's talk about Mark. He comes into the clinic. He is tired and anxious and in pain. And because you are all enlightened clinicians, you decide to mention exercise to him as an alternative way to manage these symptoms. So, how do you go about this? Handing him a piece of paper about the benefits of exercise, just telling him to start walking 30 minutes a day, asking him what it feels like is the best place for him to start, or a combo of A and C. Yeah, we're going to talk a little bit more about this in the upcoming slides. So let's first talk about some of the barriers and facilitators to exercise for people who have cancer. The barriers to exercise, the biggest three are treatment-related side effects, that they feel like they don't have any time, and that they're tired. And those three things are big deals. If you're not feeling well, you're not going to feel like getting up and moving. If you are, still trying to work or manage a family and go through cancer treatment, it can be really hard to take the time for yourself to exercise. And then the cancer-related fatigue is just really debilitating for folks. But what we know is that once people start feeling a little bit better, and they feel like they're gaining control over their health, it's going to help them keep moving. And what is so interesting to me about this is that I boxed the ones in the green where the data are actually showing that exercise makes a difference on those things directly. And so once people kind of get up and get moving and get over that hump, it's kind of this cycle where they start feeling a little bit better. And so they do a little bit more, and then they're feeling a little bit better and they're doing more. And then before they know it, they're going for 30-minute walks 5 times a week, and they're hitting that 150-minute goal. So how do you start having these conversations? And patient-led engagement is really important here. So when the patient is in the driver's seat of how and when and where they're going to start exercising, it really increases their autonomy and sort of gives them this freedom and a sense of control over their own well-being. It's also a lot easier for you because you don't have to micromanage them into doing a behavior. You don't have to necessarily force them into doing something that they don't want to do. It's best for both parties here. And I will say that while patient-led conversations are really important, there's also a fair number of patients who are just really overwhelmed and genuinely have no idea where to start. Maybe there's someone who's never been an exerciser before, and this idea of starting something at this space in their life is just completely overwhelming. So providing them with ideas about what constitutes physical activity is really important. I think sometimes people think that they have to run to have that be exercise, and that's not really the case. Walking counts, and then we can even suggest starting at 10-minute bouts. And if that's not going to work for your participant, things like parking farther away at the grocery store and then walking in, or even walking around the grocery store rather than using the riding cart, that stuff all counts towards physical activity. I tell patients all the time to walk around their houses when they go to their mailbox instead of just walking straight out their front door to their mailbox. So just adding a little bit of extra movement into that normal routine, all of that stuff really counts and gets folks up and moving. And that little bit of movement is going to really help them feel better. Also, pointing patients in the direction of community resources is important. Livestrong is at many local YMCAs across the country, and it's a free program available to cancer patients and survivors. And then there's also many cancer support programs in hospitals and also community cancer support programs that may provide exercise resources. And so just sort of knowing what's available in your area and if there's a cost associated with it is important when you're talking to your patients about getting up and getting moving. And then enlisting the caregiver. So making sure that the caregiver has information about why exercise is important and how it's going to benefit the patient. That's also going to provide a level of accountability. I know a lot of folks who have healthy caregiver dynamics they really sort of are in it together. You know, they start exercising together. The caregiver is helping keep them accountable for their movement. And maybe the caregiver is even helping with some of these tracking resources. So we think of things like having an Apple Watch or Fitbit, that's a great way to track. But your phone, most phones also track. Even if you don't have an Apple Watch, many phones will track your steps that you take every day. And most of us carry our phones around with us pretty much everywhere. So that's pretty accurate. And then the good old fashioned journal, you know, just writing down what you did that day and how you're feeling, and looking for patterns about on days that you moved more. Do you actually feel better than you did on days where you didn't move as much? So all of those resources are just ways to help patients kind of generate some ideas about where the best place to start for them is. And a combination approach is really critical. So putting the patient in the driver's seat and making sure that they have the information that they need to make an informed decision about what's right for them. Those two things together is going to be the best way to approach talking about behavior change and talking about exercise with your patients. Okay, so we're going to go way back to Psych 101 when you were in school and talk about the trans theoretical model of behavior change. And I really like this one because people aren't like locked into place. You can slide from different phases across this continuum. And so we're just going to talk a little bit in detail about each one of these. So most patients who come into your office are probably not in pre-contemplation. These would be folks who have never thought about exercise. They have no idea why it's good for them. They've never even considered it. And I think that most people have an awareness of the benefits, the general health benefits of exercise. They may not understand exactly why it's important for them as a cancer survivor, but I think most people know that moving is important for their bodies. Most folks, many folks who come in are in contemplation. And so these are people who understand that exercise is important. They really want to do it. It is important to them. They know that they should be doing it, but there's just so much in the way of them actually being able to do it. So folks in contemplation have lots and lots and lots of barriers. And so when there are lots of barriers there, it just feels really hard to start something new. And so for the people who are in contemplation, just making sure that they have the information that they need so that they know how important it is and why it would benefit them, and then having some conversations around what might make it more important to them. And we're going to talk about that in a little bit more detail in just a second. Folks who are in preparation, these are the ones who have bought the shoes. They've got the new exercise clothes. They maybe have a gym membership. They have a walking buddy. They have the things in place to do the action, but they're just not quite doing it yet. And so usually folks who are in preparation have a pretty good plan, but maybe there's still some barriers there that are getting in their way that they still haven't quite addressed or figure out how to work around. People who are in action are the ones that are doing the behavior. So these are people who are going for the walks, they're going for the gym, they're going on bike rides, they've decided that they're going to walk around the grocery store or walk to the grocery store. You know, whatever it is that is getting them moving more, they're actually doing the behavior. And then people who are in action do tend to slide back into preparation and back into action because everybody knows when you're doing something, we've all, you know, tried something new. We've tried diets or exercise, whatever it is. You go on vacation or life happens and things just come up. And so you're constantly kind of sliding between action and preparation where you're kind of addressing a barrier and then coming back to it. And so once you've been doing the behavior for quite some time, you're considered to be in maintenance. And then after you've been doing it for 6 months or more, you're considered to be in termination. And I'm not sure that anybody ever really masters things as well as we would like to, especially exercise, because it's always changing and you're always adapting how you're doing it. But it's nice to think that something could be sort of completed and that this cycle could be done. So how do you have conversations about exercise with your patient? What does this look like in real time? Um, I want to sort of say this with the caveat of I know that everyone on this call is extremely busy and that your visits are very short. And so these conversations don't have to be long. You don't have to spend an enormous amount of time talking to your patients about this. Really, just planting the seeds and putting them in the driver's seat of the decision making is a really powerful way to kind of keep people moving. And so I always start with what kind of exercise does your patient like to do? Because if they like to snowshoe and they live in North Carolina, that could be really problematic and a barrier that they probably need to work through. And then always asking about, how important is exercise or physical activity to them? And if you find that it's really important, and then they follow it with, but I just don't have any time, or I can't go to the gym, or whatever, insert whatever barrier, talking to them about what their life might be like if they did the behavior. So, what would things look like for them if they were fitter or stronger, had better range of motion? This can be really motivating to people, especially if they sort of have a long-term goal. So if your patient really enjoys travel, but has limited range of motion and strength in their shoulders because of surgery, and so when they travel, it's embarrassing and frustrating to them that they can't get their suitcase from the floor up into those overhead bins. Sort of helping them put it together that a little bit of exercise and some strengthening exercises would give them the freedom to be able to do that themselves, and that would feel really good for them. And then if your patient is starting to really get close to doing the activity, or maybe they're doing it sometimes but not all the time, or they tell you, oh yeah, I've got the gym membership, I just haven't gone yet, asking them what they need to be successful and really helping them figure out what it's going to take to get them up out the door to do the thing that they want to be able to do. That can be a really powerful question to help people sort of think through the actual process of doing the behavior. And then if they're doing the behavior, they're actually out there exercising 3, 4, 5 times a week, give them a high five and tell them that they're crushing it, and keep them going and cheer them on, because that's really important too. And the whole point of these conversations is that your patient is going to be able to create an actionable goal. So rather than just sort of saying like, okay, I'm going to walk for 30 minutes, you want to help your patient through these kinds of thinking questions and open-ended questions and little snippet conversations, really help them set a SMART goal. And SMART goals are specific, measurable, attainable, relevant, and timely, or time bound, depending on which way you look at it. And the whole idea is that it really sort of gives them an action plan and a guide in one sentence. So a goal that is specific really does drill down exactly what they're going to do, how they're going to do it, and what they need. So I'm going to go to the gym 3 times a week, and I'm going to lay my clothes out the night before so that I can get up and get out the door. If it's measurable, it's going to tell you about the frequency and the duration. So 3 times a week, 30 minutes, that sort of language needs to be a part of the goal. And then if it comes from them, it's pretty likely that it's going to be attainable. So this is where that's sort of like handing them a piece of paper that says exercise 30 minutes doesn't always work all that well. But if your patient says, well, I can do 10 minutes twice this week and then 20 minutes one day this week, that's much more patient driven and is going to be more attainable to them. And then same with relevance, helping them figure out if this is important to them. Do they even really care about exercise? And if they don't, making sure that they have the education that they need so that they know all the really important benefits of exercise. And then time bound, when exactly are they going to do it? And when is the deadline? And so the whole idea is that they're going to leave your office with a sentence like this: until my next appointment, I'm going to walk 3 days a week for 20 minutes. That's going to really give them and you a framework for what their intention is and a goal for them to strive for, so that when they come back into your office, they're able to say like, I did it, or I did it most of the time. And that's a success too. And so patient-led conversations can be kind of tricky sometimes. And so I just wanted to provide some pointers about what these might sound like and look like. Usually these patient-led conversations use open-ended questions. When you're talking to your patients about exercise, avoiding questions like, well, why haven't you done it? That can feel a little bit judgmental and can really turn patients off from entering into that conversation with you. And then also when you're working with your patients and having these short conversations, just reflecting their words and their emotions, body language and nonverbal communication is a really important thing to reflect when you're talking with your patients, especially about behavior change related to exercise and in the context of illness. It can definitely be emotional for patients who are sort of going through cancer treatment. So now I want to talk about exercise resources at UNC. The mission of our exercise programs is to provide comprehensive exercise programs that meet the physical wellness needs of cancer survivors of all types. Many of our programs also serve as a place where we educate cancer survivors and also a platform for students. So we train a fair number of students about what exercise oncology looks like and how exercise really could benefit oncology patients. And then our purpose is to provide compassionate and effective exercise programming for all North Carolina cancer survivors, which is why I'm telling you guys about our resources, because everything that I'm about to talk about, most of the things I'm about to talk about, are available to cancer survivors across the state. So the first program I want to cover is Get Real and Heal. We have been around since 2006. We started as an exercise research study for stage 1 through 3 breast cancer survivors and have since shifted our focus to include patients of any diagnosis or stage. In our current community program, we're offering 12-week programming that provides moderate intensity individualized exercise to patients of all types in small groups 3 times a week. So patients come into our facility, they have a workout of the day that is scaled based on their preliminary assessment that they get as a part of our program. And then they do their workout under the guidance of an exercise physiologist who is trained and certified in cancer care. And all of our workouts combine all of those really important components in addition to balance training. So aerobic, strength, flexibility, and balance training is part of all of our workouts. And the really great thing about this program is that it's completely free. And our patients do fill out that PAR-Q. So it's possible that if you refer a patient to us or a patient self-refers, that our team will reach out to the oncology team just to make sure that we're not missing something to keep them safe. Because we know that not everybody lives in Chapel Hill or has a lifestyle that allows them to come into the gym during the day, we offer a remote exercise program. We offer live classes on Zoom 5 days a week, and we record all of these classes. So if someone can't make it to our live workouts, they have access to our library of, I think it's close to 500 workouts now. I mean, we have a huge library of workouts for people to pick from. And those are posted on Facebook and also off Facebook. And this program is offered for free as well. And there's no time constraint here. So once a participant is engaged with the remote program, they can stay in the remote program and keep coming to classes for as long as they want and need to. The other really nice thing about our remote program is we do offer one-on-one sessions with our trainer. So for someone who's engaged in our remote program, they're still getting that one-on-one attention from a cancer expert. Even though it's over Zoom, they still are able to set up a meeting with our trainer and go over workouts and talk about modifications and make sure that that really important individualized piece is there. And also the accountability and just the opportunity to sort of be seen by our program. So through the Get Real and Heal program, we offer a few other types of exercise classes. We have a yoga program, a Zumba program, and soon to launch our Walk to Wellness program, which is a partnership with Chapel Hill Parks and Rec. And all of these things are free, and participants can be engaged in these programs for as long as they want to be. And we hope that they'll just stay and be involved and build this community of wellness-minded cancer survivors and cancer patients who are all sort of engaged in our exercise program. This program is only available to UNC Chapel Hill patients because it's a research study. This is our health coaching program. We are trying to improve or maintain quality of life in patients who have metastatic or advanced disease. And this program is open to English or Spanish-speaking patients. Participants are randomized. They either get to be paired with a health coach, and they work with that coach weekly, and they get symptom monitoring every week, and then navigation, or a control group where they just receive standard of care and then an assessment at baseline 3 and 6 months. If a participant is randomized to the control group, they're still offered coaching at the end of their control group time. So they would spend 6 months as a control and then up to 6 months working with a health coach. So we've got some really great stuff going on, and I'm sure you're wondering how to get your patients involved with us. So you can always email me or call me. I also put Get Real and Heal's phone number on there too, because you can call Get Real and Heal and send patients to us directly. I am also in Epic, but to keep everybody on their toes, I'm Charlotte Bailey in Epic. And I have a dot phrase that you can use in your after visit summaries, which is .getrealavs. I am working with the Epic team to make this available to the whole cancer center, but right now you have to email me and let me know that you want access, and then I'll add you so that you can use this dot phrase. We also have a program order, so you can search for OncX and put in this order. You can choose any of our programs. There's also a spot where you can type in anything else that you're interested in your patient being engaged in. And then this actually is going to serve as your medical clearance as well. So our program isn't going to come back to you and ask for additional clearance if you refer your patient to us this way. And so this is just kind of what it looks like. You can see that extra box where you can populate any other information and enter in your clinical concerns and any comments that you have that we need to know about before having them engage with us. And so all of our exercise programs, but Get Real and Heal specifically, we're always looking for partnership for research studies. We are capable of doing research. We can help with that process and would love to partner with folks. And I'm also always looking for other sites across the state that want to launch Get Real and Heal at their individual hospitals. And same with community partnerships. I'm always interested in bringing exercise to the community as a whole. And so building exercise programs for the cancer community, like outside of the 4 walls of UNC or other hospitals, is really important as well. And this is my list of citations. And I think that's all I've got.
Thank you, Carly. This was great. Thank you for sharing your expertise and your enthusiasm for, the health and wellness of cancer patients. So for our audience, please, if you have questions for Carly or even comments, you can add them to Poll Everywhere, and you can chat with Carly. So Carly, our first question is, what do you suggest for patients who cannot afford a personal trainer or gym membership?
That is a great question. And that's something that many cancer patients have that experience. And so finding a Livestrong program near them, if they're local to Chapel Hill, they can come to Get Real and Heal for free. There are also lots and lots of online resources, lots of YouTube channels and things like that. And if a patient is going to do a program that isn't supervised, they definitely just make sure that they're talking to their doctor about, any limitations that they have or things to look out for. But there's lots of stuff out there in the world for people to get involved in.
You made a comment also in your SMART goals, but I think one of my biggest challenges, and probably most people, is, that behavior change, right? So I'll have a patient leave my visit and say, I'm going to do this. And then when I see them back, they're like, nope, I haven't done it. So now it's become a thing where I walk in the room and like they don't even say hello to me. They respond, nope, I haven't exercised yet, right?
Yeah.
So the reiteration, I don't know if that helps with behavior change, but I find this is one of the biggest challenges, no matter how detailed you get. I think you were very clear on how to help patients do that. But I guess that was more of a comment, unless you have something else to add to that.
Totally. And I would say for that patient that like when you walk in the room, they're like, nope, haven't done it. Um, I would follow that up with like, well, what would life have been like for the past X number of weeks had you been exercising? Just kind of trying to help them figure out like what benefit is exercise actually going to be adding to my life. And some people may find that like it's not so much like going to the gym 3 times a week that matters, but maybe walking with their spouse is really important to them, or getting back in their garden, or I don't know, planning a cross country bike trip in the next 5 years, like whatever it is. And then that is going to help you sort of reframe this idea of like, well, you don't have to go to the gym for it to count. You can go and just move, and that counts. So like, how are you moving? Just helping them kind of put it all together.
Yeah, I actually like your suggestion of getting them to reflect, if they did it, what do they think that would be like? I think that's a different way of thinking and challenging the patient to kind of think through that and like say it out loud and acknowledge that.
Yeah.
So a quick question in the chat about these remote programs. Are they for adult cancer survivors only, or are they applicable to children, adolescents?
So adolescents and young adults, yes. Pediatrics, I would say no. We are just not really set up to meet the needs of the pediatric population right now. If there becomes a demand for that, or somebody specifically wants to talk about what a pediatric exercise program might look like, I'm happy to do some research and brainstorm.
Any other questions for Carly? Okay, not now. I think one other comment, or what your experience, Carly, is I've had some of my patients who have been involved in like Live Strong or Get Real and Heal programs. And I think if I'm going to kind of stereotype a little, I think breast cancer patients are really good about advocating for themselves, about getting into these programs and participating. In different populations who may be, quite sick, or, for example, I work in, GI, where, nutrition, all of that are major issues. And I've even had some patients that show up to these programs and they're like, I'm so different than what I see participating in these programs. And I've had some patients that are okay with that, and some that like it makes them feel bad. So I know that's a challenge for different cancer types.
Sure, totally. And I think that the only way to get around that is to have a wider variety of cancer types engaged in our program. So, getting those referrals to those programs and really sending patients and just encouraging them to go, because the only way it's ever going to change is if they start going, and so that there's more and more people that are like them in those programs. And we've seen that shift at Get Real and Heal over the past couple of years. We're starting to get a wider variety. We're starting to see some men coming into our program. It's happening. It just takes time, and it takes folks who are kind of willing to be a little bit different and then start talking about how beneficial it was to them. And that really does actually make the difference.
Yeah.
Or they can join remotely, where they don't have to be like seen.
Yeah, valid point. Who do you think, I think I have what I think, but I'm curious from your experience, like, where do patients respond the most when they hear the importance of exercise? Is it from their oncologist or, advanced practice provider? Is it from nursing? Is it from family or caregiver? Or is it a mix? What's been your experience?
I don't really know. I think my hunch is that it's probably a mix, and that the person who is most meaningful in that conversation is the one who is the most meaningful to the patient. So if you're an advanced care provider or an APP and you've really built a strong relationship with a patient, going ahead and just sharing this information because you know they respect you, you know they care about your opinion, and you've got that relationship there, that could be really valuable. And also sharing it with their caregiver because that can be really powerful too. So I don't really know. I don't have a definitive answer, but
yeah, I don't know if there is one either. But yeah, I mean, I think you bring up a really important point.
Yeah, and I think everybody needs to be sharing this information. I mean, if you're a nurse, if you're an APP, if you're a doctor, if you're some other kind of clinician, like this is just really important information to be sharing with patients. And it really does make a difference in their health and well-being. And they don't have to go and run a 10K right after their treatment is over or ever to have it be an important part of their long-term health and have short and long-term benefits for them.
Yeah, great. Well, thank you again. Just a quick comment before we wrap up here. I think that involving caregivers makes a huge difference. They often provide inspiration. The supervision that you mentioned and doing activities together helps both.
Totally. Yeah.
Agree. Thanks for sharing. So thank you all for participating and attending this afternoon. Thank you to the University Cancer Research Fund and the Lineberger Comprehensive Cancer Center, as well as the Lineberger Cancer Network, our telehealth team who makes all the magic happen. Thank you to them, to Tim, Benny, John, Oliver, Andrew, Naja, Patrick, Lindsay, and Barbara. Our upcoming live webinars, save the date, check them out. We have a head and neck management in North Carolina. Our patient-centered care is focusing on improving the lives of AYA with cancer. And then our next advanced practice provider live webinar is continuing our series on oncologic emergencies. And then if you've missed some webinars that you're interested in, lots of great topics, check them out. They're self-paced, online, eligible for continuing education credit. So check them out on the website, learn.unclcn.org. So thank you all for participating. Remember, wait for the webinar to end for your attendance, and have a great night, and we'll see you next time.